I'm proud to be here today. You said experience from outside the Alliance. Actually, I consider myself also part of the Alliance, being a professor here also in Wageningen. So maybe I'm a kind of a bridge from science to policy. And I'm happy to share with you the experience of the Health Council, how we are thinking about health, or at least struggling also a bit with the concept of health. So I will show you a couple of ideas just to inspire you. It's only 15 minutes, so I must go fast, but that you get some inspiration for discussing this broader concept of health this afternoon. Could I have the next slide? This is about my conflicts of interest. I'm always obliged to do that. So I get money from the Regio deal, Food Valley, and some foundation, and I have no commercial conflicts of interest. So next slide, please. So the Health Council of the Netherlands, it's all about translating science to health, maybe even food and health policy. And we give that advice to ministers and the parliament, so Eerste en Tweede Kamer, so to say in Dutch. And we have committees of over 200 top scientists from all Dutch universities. Maybe some of you, I know Roel at least, is participating in these committees. And together we make advice based mostly on request from the departments. So next. And we do that in a transparent way with multidisciplinary approach, so top scientists looking from many different angles at the same problem, and independent, so we also check conflicts of interest. And we try to not be influenced by any lobbying, for example. Next slide. Could somebody make this work? Because that could be easier for me. So we produce about 25, 30 reports a year, doubled during the COVID pandemic, as you may understand. And most requests we get from the Ministry of Health, VWS, and also from other departments, including the Department of Agriculture. Next one. So over 95% of the advice given by the Health Council is actually implemented in policy. So that's quite important. So try to get your research into the Health Council's advice in a good way, because that really can make things change. Our goal in the end is, of course, to preserve, but also protect and promote human health. And we do that in various domains, including nutrition, but also vaccination, prevention, occupational risks, harmful toxic substances, all these kind of issues. So then we also consider the concept of health. What is it actually? And I have 3 points that I would like to address today. Health is more than just the presence or absence of disease. Health, is it more than human health? And the other thing, health, is it accessible for all? So we, as Health Council, we were involved in an initiative that was published in the BMJ, a medical journal, to redefine the concept of health. And the definition that was that emerged from that initiative was the ability to adapt and self-manage in the face of social, physical and emotional challenges. And that's quite a bit more than just being sick or healthy. It can even mean that people with chronic diseases are more healthy than those without any disease, because they are able to manage their condition and their social life, and they have connections also to others, for example. So in this broader concept, when we consider bodily function at the top as a kind of old-fashioned definition of health, you can also consider mental well-being, meaningfulness, quality of life, which is actually in the mission also of Wageningen University, participation in society, having a job, and being in social interaction with others. So the total picture is important for the concept of health. But how can we address that in the Health Council? Well, that is not that easy, because we often get requests from departments And these requests often are about the actual diseases. They're not that much about the ability to cope with daily life, to handle emotional struggles, to be socially interacting with others. So as long as we don't get these questions from our policymakers, it won't end up a lot in the Health Council reports, although we have the ability to give advice unsolicited. So we can also make advice ourselves, but that's only 10%, I would say, of our advice. Also, the Health Council has strong links with the medical field, with the clinical field, and we are in need for high-quality scientific data. And it's sometimes more difficult to get these in the more softer part of science, the way we have our data analyzed and interpreted in the advice. And that might be something to discuss also this afternoon. What kind of data are needed for health policy? And there's, of course, a lot of focus on chronic diseases because we are suffering from that in our current societies. They have enormous costs, and it's even going to rise in the future. There's enormous healthcare cost issue going on, and if we don't act now, we will have a really big problem in, say, 2060. So now it's about 10% of our gross national product, and I guess it's about the same or even more, like in the USA, in other countries. So something has to be done now, and therefore I'm also very happy with the Institute for Preventive Health and the EWUU Alliance, because that's what we are going to do. We want to shift from solving the problem to preventing the problem. And there we can make use of the knowledge that's acquired at the technical universities together with Utrecht. And I think that's a big initiative that's being taken here by these universities. I also like to mention here the GALA, the new agreement, also by the government to really invest in prevention and make a more healthy living accessible to all people and prevent chronic diseases. So this whole symposium, I think, is in the heart of this discussion and shifting from cure to prevention. The second aspect I would like to mention is it all about human health? We can put human health in the center, but we all know that we have a climate change going on, and maybe the older people in the audience remember when you went on holidays. When I was a child, when we were driving the car, every now and then we had to get out to clean the screen of the car because of all the insects. Well, I think most of that has disappeared. I don't see them anymore on my car. And if we wait any longer, there might not be even a human driving anymore. So there's quite some discussion going on also in the Health Council. Is human health something to focus on? Or should we focus maybe on One Health, so in interaction with the animals? Should we go broader even and focus on planetary health? So this is not easy, because when you focus on planetary health, there's a lot more going on than only the healthcare system and health prevention measures. So it's not easy to decide on that. We can't be too broad and cover all as a health council, because you also need that specific expertise on board in your network. So it's not that easy. Climate has an impact on human health. I've just taken a picture from the WHO. You can see many ways by which climate change could affect human health. And that's a lot, and that may also be a problem in the near future, in the future more far away. But also human health has an impact on the climate. So in the Dutch healthcare system causes 8% approximately of greenhouse gas emissions. And for every surgery done, there's 27 kilos on average of waste. So we also cause with human health a climate problem. Recently, we have advised to embed the concept of sustainability in the whole basis of good healthcare. So a good healthcare system should, the Health Council considered that sustainability should be part of the healthcare system, not something that comes along, but really be in the basis of that. So what makes it so difficult for us to go beyond human health? Well, first of all, we have a legal task as a health council to advise on human health. And most of the requests we get from the Minister of Health. So also, when you go broader and having a more systems approach, you also need the collaboration of the different departments in The Hague. So then Ministry of Health should collaborate with the Ministry of Agriculture and Infrastructure and maybe Economic Affairs and others. So it's a broad approach that you would need also there. And the current approach we have now at the Health Council is to focus on human health while not harming the environment. So that's a kind of approach that we have now. So we consider the environment, but we cannot do planetary health as an outcome, or not yet. We do have the ambition to put more emphasis on sustainability aspects in future advice. And we are now designing the dietary guidelines of the future. And yesterday we had an interesting workshop on how broad will we address the concept of health in the new dietary guidelines. Because we know it's not all about biomedical aspects, not only about what you eat and what causes disease, but also how will people perceive such a guideline? Can they change? Also the consumer aspects, but also the sustainability and the climate issues. So we have written an advice on our ambition, and you can read that on the internet, that we want to go beyond just the biomedical aspects and also include the sustainability and the consumer aspects. Then finally, health, is it accessible for all? We know that high-income people have about 5 or maybe even 6 more years of life than people with a lower income. And when it comes to years in good health, it's even a bigger gap. And I can even see that in my own family. I have a cousin who was not that lucky getting the same type of education as I had. And when sitting with her and having a coffee, I suddenly realized that she might have many less years of life expectancy than I have, while being in the same family. And I guess some of you can even think also of friends or relatives who are in the same position, being less privileged as you are. And is it then morally justified to further benefit the health of those who already do well, while ignoring the fact that others lag behind? Or should we invest specifically in those who need it more? So that's an ethical question that is also part of the discussions at the Health Council. So about the health disparities, that also require interdepartmental collaborations. That also requires that ministers ask us about that, to advise on that. And we need to have a kind of systematic approach for all our advice, not only nutrition, but also vaccination, also toxic exposures, and many other issues. We need scientific expertise on that topic, and we are glad that we have Professor Maria van der Muizenberg, who did a great job in the Health Council addressing this issue and emphasizing that we do have to pay attention to it more in our advice. So this is my final slide to close with. I think science is really important. The Health Council advice is also important, but that alone won't solve the issue. I think we all have to consider our own responsibility and maybe even attitude towards this problem to may help solve this huge crisis that we are facing for the future. Well, thank you very much for your attention.
going to explore a little bit how the initiative, the Preventive Health Initiative of the Alliance, take a seat, looks at the challenges and the issues that Marianne just raised over here. And I therefore have here Roel Vermeulen and Martine van der Mast. So welcome to you. And before I will introduce you, Roel, welcome to Martine. Martine van der Mast is the Program Director of the Preventive Health Initiative of the Alliance. And you have a background in nutrition and a whole lot of experience in bridging the science with the food and health market. And maybe for the people to know as an introduction, you can tell something about the Preventive Health Initiative and what you're doing with that program.
Of course I can. Thank you for the question that you pose. And thank you, Marianne, for setting such a nice scene here, because what we really like to do within the Preventive Health program is trying to solve a lot of those problems, or at least contribute to that. We see a lot of challenges like the health gap, the growing older, the population that grows older. So there are a lot of challenges that we want to solve, and that we also need to solve. And the good thing is that there is also a possibility to do that, because with the 4 institutes that we have, there is a lot of knowledge that we have available to also close, for example, the gap. And in Eindhoven, there is a lot of technology, in Wageningen, food and nutrition and the food environment, social sciences in the several institutes, and in, of course, the UMC, the medical part. If we combine all those knowledge parts together, I think we can solve at least part of your problems.
Well, it's luckily not only your problems, it's all of our problems.
All our problems.
But we're working on that. And Roel as well, Roel Vermeulen, you're a professor in environmental epidemiology, but also connected to the Julius Center of Health at the UMC Utrecht. But I was also curious, because when we were listening to this whole approach of human health, public health, all the way up to planetary health, you have this professorship in public health. So I was curious how you look at Marianne's approach and also the challenge that you put up there on, well, the whole concept of health and what we should be working on.
Yeah, thanks, and thanks, Marianne, for the lovely presentation. I can only agree on the 3 points, right? I mean, health is more than the absence of disease. We actually want to make sure that people can actually live up to their maximum health potential. We want to make sure that we don't have large inequities basically within the Netherlands, but also beyond our borders, something that Arthur was pointing out as well, that it doesn't stop basically at our borders. I think the more difficult question is basically on the planetary health thought that Marianne was bringing forward. I think if you take the Rockefeller definition of planetary health, it basically says human health and the health of the ecosystems that our health depends on. And I think still that it basically focuses on human health, but it's recognizing that there are things going on that actually may have a large impact to human health. And climate change is one of those where you can think about the loss of biodiversity, the loss of pollinators, and suddenly we have a food crisis that may have very, very large health consequences. And I think that we have to start thinking of going from point solutions that we do now, sometimes only on human health, sometimes on one single topic, to basically try to think more from a system approach and try to factor those in. That comes with all kinds of problems, because these externalities have different owners, either from a political arena. That is true, but I don't believe that we can actually solve these problems by point solutions. So although it might be uncomfortable and might be difficult, I don't think we have at this moment any other way to go than actually taking that system approach and to actually take that broader view on health.
Yeah. Well, I think maybe that is also one of the points that you already raised, Marianne, of, well, one of the challenges is that you get these requests by the Ministry of Health. What other, let's say, challenges do you see when you look at translating science into policy and the application of it?
Yeah. Well, of course, also I agree totally on what you said, Roel, and I think also the task of the Health Council is to bring departments a bit together, to have, prior to getting the advice, some alignments, if possible, between different departments. So that's something we aim for, of course. But the further you go away from one specific problem, like human health and including the total environment, then it's also getting a political problem, and it has to do with values and how do you weigh one against the other. So that's a bit more complicated. Challenges for translating science to health policy. I would say, first of all, high quality data, of course, obviously is needed to be able to make substantiated advice. So good methodology, answering the right questions, like on the health disparities. When you are doing a study, think of including a specific sub-question on that issue and give data and tables for that specific group, for example. So it's already in the data that things are lacking, that we cannot proceed with making a more tailored advice to different target groups in the population. So good science is important, but also have it on the research agenda of your research group, or your make it an ambition to help solve the health disparities. It's not only for social sciences, it's also for biomedical sciences, because there we also need the data, and also for technical solutions. And so it's in all of our work, it should be kind of addressed, I would say. Okay. For this specific topic, I can say many more about how to translate to health policy, but I know you have many more questions, so I leave the floor to you.
A whole list,
so,
you know.
Yeah.
Well, but I already heard twice, I completely agree with this. Is this also something you agree with, or do you see other challenges besides the ones already mentioned by Marianne?
Yeah,
translating.
It sounds like you solicit for the question that I would say that I don't agree. But no, to some sense, I agree. And the discussion that we can have is basically how much scientific knowledge and data actually moves basically the problems that we have in preventive health. And in some regards, of course, scientific knowledge is important because we want to do evidence-based interventions and so on. But I actually was, the slide went away, but I was actually looking at Gus Speff, the one that you quoted. And I think, he is an American environmental lawyer, and he basically points out that we need 8 transitions to actually make a difference. And that's market transition, corporate transitions, growth transition, transition in investment and finance, a social transition, a lifestyle and cultural transition, communities transition, and a democracy transition. I'm just reading those out. This is an awful lot, I realize that. But I read those out because it's clear that not only biomedical information is going to change basically how we actually make a change in preventive health. So we actually have to look at all these barriers. Why is it now that we actually cannot implement certain knowledge that actually would be beneficial? We talk a lot about healthy food and nutritious food, but we still see that we have an obesity problem. We have been talking about smoking for 3 generations, and still, we see now actually smoking rates in youngers not going down or even going up. So there are really things that we have to think about. How do we change that politically, financially, and socially? And that's also my plea here actually to the wider alliance, that this goes beyond basically the biomedical field. This actually involves basically law economics. This involves sociology. Because if we really want to make a change, we actually have to get all these things basically sorted out to really get a transition that is sustainable and is going to work.
Well, I'm happy that you have this audience then here to give that plea to, and I hope it arrives.
But I do think, like you mentioned, we need also these transitions, but we also need these data at the Health Council. So from social sciences, from other fields, that has been undervalued a lot in these advice.
What do you mean exactly with that?
Well, when addressing the obesity problem, you can tell people what to eat and what not to eat, but it's a system failure. It's a much bigger problem. We need the drivers. Why do people eat what they eat? And there's science going on also in our universities on these drivers, and that has not yet been implemented to the fullest in the advice by the Health Council, for example. So I think there's also, from that point of view, it's about doing, but it's also about substantiating and sending the message to the policymakers in a good way. They need that substantiation as well, because their intervention should be causally related or effective. Otherwise, they might invest money in something that in the end might not work. So they do need the actual tools to intervene on. So
and a perspective on a system level, because we see that not only in health, of course, that just all these separate solutions are not building up to the future that we're aiming for. Maybe Martine also, these are all challenges of translating science into policy. If you look at the role of the Alliance and especially the Preventive Health Initiative, how do you see the role, and how are we taking up these challenges here?
Well, I think that our role is especially bringing scientists together, like Arthur already mentioned, different disciplines, bringing them together, and also unusual collaborations, which is also a part of the Alliance. Just look at different things, different ways of looking at challenges that we have, and bring in a philosopher. We have them in our group of bring in social sciences into technology, and technology into social sciences. So that bringing that together will give transdisciplinary research also if we involve our partners, because we have a huge group of people that we know outside of our institutes, and they are also necessary. Policymakers, the Health Council, the companies, technical companies, patient organizations, all those groups are needed. So this transdisciplinary research is super important. We need to do implementation work, implementation research, but also try to make that applicable to larger geographical areas, for example, regions, national, the whole national world, or the whole of the Netherlands, or maybe even international, like you mentioned, Arthur. And I think by doing that, we can address, for example, this large gap that we have with the health disparities, but also with other challenges that we have. I think one of the projects that might give an example is a project that we recently got granted, which is called the LIFTS proposal. The PI is Kirsten Verkooyen. She's not in the little video that you're going to see. But I think that gives a good example of how we approach, or it's a way how we approach this problem.
Let's take a look.
Adopting a healthy lifestyle can be difficult for anyone, but especially for practice education students who face challenges due to learning disabilities, low literacy, behavioural problems, and growing up in a low socioeconomic environment. With our research theme, Preventive Health, we aim to address the complex and multifaceted nature of preventive health issues. In the research project Healthy Lifestyle for Low Literate Teenagers, in short, LIFT, we focus on how to effectively promote health among practice education students.
The target group we are talking about are students from 12 to about 18 years old with an IQ of between 55 and 80. So they have problems by learning in the traditional way. They learn by doing. The tools they need are devices and apps that support the way they learn. So repetition is, for example, very important in the education of this group.
There hasn't been much research on this target group till now, but what's interesting is to not only understand how to improve the food environment, like the school canteen and the supermarket, but also how to motivate them, for example using apps, and how to best develop these apps.
Mobile apps tend to have a large persuasive effect on children, actually to the level that they get lost in these games that we have these days. The question that we will try to answer is how can we turn those technology principles into persuasive techniques that make them move more, eat healthier and feel better.
We really want to integrate the target group into our design process, because a lot of apps come top down just from the market or from some researcher that had an idea, but they're only really effective if you involve the user from the start and you design together with them what they need in their daily context.
Within the Alliance, Eindhoven will focus on the use of wearable technology, where we take full control over the data, also all data from the mobile phone, to personalize behavior change. That is the unique asset that we bring to the project, and of course we'll have to figure out how to tailor it to make it most effective to this target group.
Most research has been done on behavior change measures that use infographics or text to inform the users, and that wouldn't work for low literacy users, so we really don't have a lot of standard ideas for this target group yet.
There are no results yet, but I think it's important in the study designs that we really co-create the interventions together with them, so that they are involved and that we take them seriously.
The LIFTS project serves as an example of how we bring together behavioural, nutritional and technical expertise, resources and networks in the preventive health domain.